I want to circle back around to what we're talking about, just as a recap. We've talked about Medicare Part A and B and what's left over. What we're talking about now is ways of taking care of your extra cost. Under a Medicare supplement world, you have your Medicare supplement that will pay, depending on the plan you choose, it can pay all of your Part A and Part B leftover. But you also need a prescription drug plan to help cover prescription medication. Prescription medications, you can find them very inexpensive. There's plans out there that starts as low as $1 a month. And they go up as high as $150 a month. Now, in my 14-year career, I've never had a situation that the most expensive drug plan I can think of that I issued was $106, and that was an extremely complicated case, almost 30 medications, and it was still only about $106. But there's a lot of them out there. Just find the one that fits you. Now, under this option one side that we've been talking about, you have your monthly premiums for your Medicare Part B. You're going to have a monthly premium for your supplement. You're also going to have a monthly premium for your prescription drug plan. Under the option one side, think of it as at a restaurant and everything is a la carte. You can choose a dental plan if you want or not. You can choose a vision plan or not. You choose a combination of different things or not. Every time you add something new, it adds another monthly premium to what you're doing. It can all be under one company, or you can have each one of them under different companies. But under option one, everything you want covered is going to require an additional monthly premium. Now, we've been talking about this Medicare supplement world. I want to talk briefly about who does Medicare supplements work best for. It usually falls into three categories. Most of my Medicare supplement clients live in a rural community. When I say rural, I mean if you put a pin in a map and you draw a 75-mile circle and there's less than 1 million people within that diameter, you're pretty much in a rural community. In those communities, yes, Medicare supplements tend to work extremely well because there's not a large network of doctors to pull from. It can be hit and miss. So anything less than 1 million people within 50, 75 miles, you can consider that a rural community. Those areas is where the majority of my Medicare supplement clients fit. The second area that they fit is when I have clients that are very mobile. And when I mean mobile, they have more than one property usually. They're traveling extensively. They're away from their home base 3, 4, 5 months at a time, visiting families, RVs. I'll tell you this quick story about a client of mine that retired, and her goal in life was to volunteer at every national park she could be accepted at. Didn't matter where it was, so over all the summer months and going into fall and spring, she always went to a different national park. I had no idea where she was gonna be at from 1 month to the next, or 1 year from the next. So we put her on a supplement plan, so wherever she went, no matter how small the area was, all she had to do was ask a doctor if they was willing to see her under Medicare. So again, a person that lives in a rural community, a person that is extremely mobile, or a person that is currently going through a severe illness. If you're transitioning into Medicare and you have an illness that is not being controlled, or a serious illness, those are other people that Medicare supplement works extremely well for. It typically has nothing to do with how much money you make or how poor you are, or your limited income. It all has to do with just simply your lifestyle and your situation. The last thing is what I talked about and hinted to the first time. If you're a type of person that manages your own health, you only go see a doctor when you have to, but other than that, you treat everything yourself, herbally or otherwise, a Medicare supplement, again, is going to work extremely well for you because it gives you that versatility to mix different health conditions together, not health conditions, but health treatment plans together as you deem fit.